Welcome to Beyond the Flare, a podcast from IFPA, created in partnership with Johnson & Johnson. This is a space where voices from across the global psoriatic disease community come together to share experiences, insights, and ways we can shape a healthier future together. I'm your host, Janina Kostugaite, and today we are unpacking what long-term holistic psoriatic disease care actually looks like in real life. And before we jump into today's topic, let's hear who we have with us. So would you each introduce yourselves?
So I'm Joel Nelson from the UK, a patient advocate and person living with psoriatic disease.
My name is Emmanuel, or Manny for short, and I'm a dermatology advanced nurse practitioner here in the UK, but also a PhD candidate as well over at the Centre for Appearance Research.
Thanks so much. It's great to have you both here. I really believe that you're the perfect pair to explore this topic with. And to start us off, maybe with you, Joel, when you think about long-term holistic care in psoriatic disease, what comes to mind for you?
For me, it's about patients as partners, and not only sort of having a hand on the wheel in my care, but also the knowledge and the confidence to make day-to-day evaluations and decisions to manage well between appointments. So it's about having a multidisciplinary sort of joined-up approach, but also importantly the involvement of caregivers and the recognition and the inclusion of the burden of psoriatic disease on my mental health.
Okay, and Emmanuel, from a clinical perspective, how would you define holistic care?
Yeah, holistic care is sometimes can be quite an abstract concept, but it's really taking into account the human as a whole. We really need to take a step back and think about not just about what medicines we're giving people, but lifestyle, what they're eating, how they're managing stress, exercise, it's taking how they're sleeping, and all of these things into account rather than just focusing on just the medicine and focusing more holistically.
Yeah, I see. Like hearing you both define this holistic care, it really shows that it's so much bigger than treatment alone. And Joel, coming back to you, you've talked at a lot of events over the years, and I must say I really appreciate how openly you share like the everyday realities living with a disease. So thinking back to when you were first diagnosed, how has your understanding of the condition changed since then?
It's changed massively, and it's been shaped largely by the conversations I've had with my sort of medical professional team, because as a child, the priority was very much always on my joints, on my disability, my mobility, getting me back or keeping me in school. But nobody asked me how the rashes on my body made me feel, especially when I was sort of entering my teenage years with psoriatic disease. And there was times where that definitely was more of an issue to me than the disability. I've come to sort of recognise how that all sort of feeds back into the mental health impact of psoriatic disease, and I know I use the term mental health burden a lot, but it generally is that, in that if mentally I'm struggling to cope with living the condition, then obviously that has much far wider impacts on the management of it. Nobody asked me about what mattered to me, what my priority was, and I'll often describe how, I can have the smallest of rashes in an unseen place, and that can affect my confidence far more than a huge rash maybe on my torso that could be covered by a shirt. And I think another example of where my knowledge and everything has just massively changed over the years. I lived with high cholesterol for years, ever since I was young. Didn't matter if I was young, fit, older, slightly overweight like I am now, my cholesterol stays consistently high. And I never had a conversation with a medical professional or a doctor about that. It was purely through, I was sitting at a conference when I first heard that there was this link with male obesity and high cholesterol and psoriatic disease. So it feels like so much burden has been placed on me as the person living with the disease to join these dots. And I think that's sort of important that we mention that when talking about understanding, the psoriatic disease impact on you as a person over time, because it's such a journey you have to go on as an individual to discover these things.
Yeah. Thank you, Joel. It feels like you painted this honest picture of the learning curve, if I can phrase it like that. And Emmanuel, do you hear similar stories from the people you support?
Oh, definitely. I think, Joe, you really nicely kind of summed up there around about how you were kind of connecting those dots. But I think it's one of the challenges as someone that deals with patients is obviously this is an international podcast going out to an international community, and every healthcare system has its own strain. But I'm sure within the NHS in the UK, I'm not alone in saying that there's constantly a pressure to see patients and people in shorter and shorter time. And sometimes that means that holistic conversation of having those discussions around things like, cholesterol, and actually it can be linked to psoriasis, sometimes might not get the focus that they need. So I think really it speaks of just how we need longer with people with psoriasis. We need more conversations.
And building on that perspective, now we're talking that it's not only about the treatment, it's collaboration with healthcare providers, but do you have a sense if people tend to do something at home outside of their medical treatment that would help them to cope or feel at least a little better?
Yeah, lots. So actually, this is also, I'll shoehorn in a little bit my PhD, but my PhD is around social media and psoriasis, specifically stigmatization. But definitely people are using social media as a place to get information and share peer information. But the issue with that is it sometimes might not be the most medically accurate or medically advisable, but there's these real life practical skills that people are going online and sharing with each other that I think can be very useful. But it's how can we best shape those conversations to make sure they're evidence based and not too kind of harmful in the long run.
I don't have psoriatic disease myself, but Joel, I'm curious whether any of the things that Emmanuel just mentioned resonate with your own experience.
As Emmanuel touched on, that social media world, it's a blessing and a curse. It's definitely helped me feel seen. It's definitely helped me find my community and a shared voice. And a lot of what I do today is because that community lifted me up and elevated me. But also there's another side to it, and you've got to be really careful with the information you're taking, and also ask, are we celebrating unmanaged disease, in the form of if we're starting to look at things and say like lots of rashes are a good thing for social media compared to me trying to talk about my inverse psoriasis experience where I look fine on camera. That's a very dangerous world that we've got to be careful of, and I've talked a lot on that in the past.
Thank you, Joel, and thank you both for those insights. Hearing what happens at home really helps me, and I guess all us listeners, understand how much people deal with on their own day to day. And as you said, you are lucky if we have any family support, peer support. But I will also like to explore the other side of it, the moments then the healthcare system actually comes together and you have that support. So my next question is to both of you. And Joel, perhaps you can begin. Is there a moment when this multidisciplinary care that we talk a lot about made a difference for you?
Yeah, there absolutely is a moment, and it sticks deep with me. Unfortunately, is a moment and not the norm. But when I first got introduced to biologic nurses, it completely changed my care. So I've had the same rheumatology sort of team since I was 12 years old, and in my sort of 20s, biologic nurses became a thing for me, and they were the first people to sort of know me and my priority. One lady in particular, she would know what was going on in my life. She would know what was going on in my world. She knew what my norm was, or in medical terms, like my baseline, and she would recognise when I was straying from that. And I'm not talking about what hurts and where, or where my rashes are. I'm talking about how I presented as a person, my mental health, my confidence, my mood, whether I was sort of like doing well in my career or whether I was going into my shell. All these things she was aware of, and it was the first time I'd been kind of seen as a person rather than a disease that with a load of boxes to tick next to an outline of a human figure on a sheet of like where various things were flaring, and that genuinely, I'm not being dramatic when I say that experience is what led to me becoming a health advocate and campaigning for personalised care, because I saw a different way of doing things. And obviously the pandemic changed all of that, especially in the UK. It might be different elsewhere for wherever people are listening. And that suddenly wasn't accessible anymore, and I didn't have that that named contact who could walk down the corridor and knock on my rheumatologist's door and say, look, Joel is struggling. So yeah, that's something I think is worth fighting for, because from a patient's perspective, it changed everything. And just going back into the multidisciplinary element of it is, I dream of that future where appointments consist of a rheumatologist, a dermatologist, a mental health professional, and then I can get easy access to occupational therapy, a physio, or whoever they need to bring in the room. Obviously, we're a long, long way from that. But for me, that's what a biologics nurse did. They were that go-between who could bring in all of the various voices into the room.
But do you still have that opportunity, or has it ended with COVID?
So now I have a helpline that used to be open Monday to Friday all day. Now it's maybe open 2 or 3 times a week, and you have to leave a voicemail. If the line's open, you can't leave a voicemail if the message is on to say they're closed. So I had a flare 4 weeks ago. I tried for a week and a half to get through, and I couldn't. And by the time I tried again, the flare was on its way out. So it makes a big difference, right? Because if you're my rheumatologist, you now have no knowledge that I had that flare. You have no knowledge that I was struggling. You have no knowledge that I was off work, that I was going to my GP because my mental health was low. And you just carry on and you skip off again into the sunset until the next flare. So as a patient, that certainly doesn't make you feel very involved. It doesn't make you feel like a partner. It doesn't make you feel like you're in control of your condition. And then what happens is these experiences, they layer and layer and layer. And then what happens is maybe next time I don't pick up the phone, or I think it's not worth me calling because there's people worse off than me. And in time, obviously that has a detrimental effect on not just my mental health, but the management of my condition.
So thank you for being open about that, Joel. It's very valuable to hear when those connections aren't there, and we still have a lot of work to do with our healthcare systems. And Emmanuel, from your experience, have you seen any cases, positive cases, where multidisciplinary approach actually helped somebody?
Well, as a nurse, I would say yes all the time, but I'll try not to be too biased. But yeah, I do think that the multidisciplinary team add an awful lot of value to patient care. I think traditionally, when it's more traditional models used to really just be the doctor, the dermatologist looking after patient. But as we get more and more of an understanding of how devastating the impact of a condition like psoriasis on every aspect of life, the more we realise that there's more and more need for wider MDT involvement. So there was a report a few years ago in the UK by the All Parliamentary Group for Skin, and they talked about the use and provisions of psychologists within dermatology services. As in Joel, you touched on quite a few times about the impact on mental health. And the report agreed that actually a lot of centres, if not all centres, need to have access to a psychologist, a dedicated psychologist in their services, because the impact of all skin conditions, including psoriasis, can be devastating. But reality is we just don't see that translated on the ground. I think also what Joel's example has really nicely illustrated is the concept of cumulative life course impairment, which actually was discussed really well by Dr. Margot Gnicki in episode 1 of this series. So if people want to learn a bit more about that, I'd really recommend giving that episode a listen. Now, I'm sure that's not limited to the UK, where we have a nationalised health service where it can be a bit difficult to get funding, but it seems like more of a global issue with access to various MDT people. I would say just to advocate for nurses as well, because we are so key in providing that first point of contact for patients. And in some cases, in some countries like the UK, we are prescribing the treatments as well and taking that responsibility. So I think we are an absolutely vital member of that team, not just for the kind of looking after the patient and being that point of contact and actually knowing them, but also now in a more advanced role with even prescribing these medicines as well.
Everything you've described makes me think about this importance of those consistent human interactions in care. And building on that theme of partnership, I want to bring Joel in here. So from your perspective, what does it mean to be active partner, as you mentioned at the beginning of our session, active partner in your care and making decisions together with your healthcare providers?
Yeah, and it means lots of things to different people, right? But for me, it's about not being like a silent partner, or I don't want to be left in rooms whilst others make decision about my care. I don't want. I want access to the whole like conversation, so there isn't like conference rooms full of thousands of professionals talking about what they think we need without patient voices informing that conversation. Obviously, I think it means being an equal, but I think there's another side to it in that it's about having no surprises. I've had some bad experience over the years where unforeseen changes have completely changed the course of my disease or the way that I wanted to live my life. So not having those unforeseen changes in treatment, but also knowing what a good outcome looks like, right? And what we're trying to achieve together, with any treatment plan or pathway we're on. So many times I couldn't have told you what what acceptable looked like or what good looked like, because those conversations didn't happen. So if I'm being placed on a treatment, I want to know, well, what are we aiming for and how are we going to check in on that and how are we going to measure it? And I also, making it a bit more human, because I think it's important when we're talking about these things to keep the human element. I want to be able to tell my son, who's only 6 at the moment, what's happening, why, and like when I need help, that I can get it. I've explained, already on this conversation about how access to help might not always be the easiest or the easiest thing to navigate when you're already in pain, you're already struggling. So if things change, I want to know how I can get access to that help, and I want my family to know what's happening. But there are definitely times where I feel like I can't answer that. So for me, being an active partner in my care would fix a lot of those things.
And I know you're going to so many events and conferences, so it's clear that you have a lot of knowledge. And did staying informed and informing your family change your confidence?
Yeah, massively. So it started really small as well. And I'm going to say this because I always forget to mention this in case it helps anyone listening to this back. It started really small in terms of involving my family in that conversation, in that I started wearing traffic light wristbands. I bought a green, a red and an amber or a yellow wristband, and based on what wristband I was wearing that day was how much I was struggling to cope. And then that way, when my son was like 2 or 3 and maybe too young for those big conversations, everyone in the house could kind of say, all right, Joel needs some space, or Joel's doing all right, and maybe we can ask him if we can go out for the day or do something or whatever. And them sort of, it sounds like a big stretch, right? But going to those conferences, getting that information, learning how the high cholesterol thing is not my fault, and no matter how long I spend on a treadmill a week or how many games of rugby I was playing back then, that was never going to change, then fed into how I felt about myself, or just because I understood what was happening, or some of those cogs in the machine, which then transferred back to home life, right, where I could then explain to my family what was going on. Because I cannot tell you that the darkest periods of my life is when I'm in pain, I'm in flare, and I've lost my job, my career's ruined, and I don't know why. I don't know what I did wrong. And I think the thing is with autoimmune diseases, we're very quick to ask ourselves, what did I do? What didn't I do? What was it I ate? What was it I didn't eat? And we go through all this whole scenario of, we're very quick to put it on ourselves. And then obviously that spirals our mood and everything. So I think being informed and being able to join those dots made home life so much easier as well.
So we start with communication with yourself first, and then how do you think communication between a person living with psoriatic disease and their healthcare team can be improved so all aspects of health, not just the skin, is addressed?
I think we need to change the conversation from what hurts and where to what do you need and how is the disease like impacting you in that moment in time. Because don't forget that many of us are waiting weeks, well actually at the moment months and months and months to see our medical professionals. So when we might have originally asked for help, the things that might have been bothering us then could have completely changed to what was on that original like referral from our primary healthcare physician or something. And we also need to sort of recognise, I think, that an informed patient is not a dangerous patient. They're just an empowered human being. Like, I think there is still a lot of the conversations I have at medical conferences, there is very much two camps, right? There is one side that are very much inclusive of the patient and want to hear about those experiences, and then there's another side where they are fearful, and it's like it doesn't make me dangerous having the information. It doesn't make me a threat to your expertise coming with a list of questions to my appointment. And then again, something I've touched upon already, but involve the caregivers, not just like next to kin. It needs to be whoever that person's support network is, because if they fail, I fail. Like if my wife can't cope, then I'm not far behind with the management of my condition. So we need to move away. There's been far too many times when I've walked into an appointment and I'm told there isn't space for my wife, so don't worry, we'll call her. And then they never call her, and I get into the appointment room and I have to ask for them to go fetch my wife. And all of these they might not seem like big things, but they're all barriers. And if you're low on confidence and you're already anxious going into an appointment you've waited months for, then maybe you don't ask, right? Maybe you don't put your hand up and say, oh, can my wife join me? And then suddenly you waited 6 months for an appointment and you're having to ask all those questions on your own. So we need to be closing that gap and removing those barriers.
Thank you, Joel. Emmanuel, what are your thoughts on that? What helps to create that safe space for both healthcare provider and patient?
Yeah, in terms of, I'm someone that believes centralizing the patient voice, not just in the treatment decision process, but also in the service creation and development process, is very important. I think too often patients aren't included in those dialects, and it can even be things like, how can the clinic help with patient flow, for example. Just including them in those conversations can really help centralize their narratives and their voices. To pick up on a few other things that Joel said as well, just around about making sure that their relatives and caregivers are fully involved in that process is very important. And it can be challenging, but I think an informed patient is absolutely key.
Despite working at IFPA for over 7 years now, listening to both of you, I see it even more how complex and actually human psoriatic disease is, with so many layers, and the importance of being seen, being informed, knowing your place, knowing that you're a partner in this disease treatment. And with all of that in mind, I think I would like to close with a bigger picture question to both of you. And maybe Joel, we start with you. If you could share one message with healthcare providers about treating the whole person, not just the skin, what would it be?
It would be that ask me what my priorities are as they change throughout my life journey with this disease. What mattered to me as a 14-year-old with psoriatic disease is so far removed from what matters to me as a 40-year-old man with a child. But if you don't ask those questions, if you don't ask what's going on in my life, if you don't understand the person behind the diagnosis and what their priorities are in that moment in time, then we're always going to be a long way off being able to satisfy the needs of the patients with the needs of the healthcare professionals. So that would be my message.
So I'd actually share with them a little tip that was taught to me by Dr. Sandy McBride over at the Royal Free in London. And she used to always ask patients, if I had a magic wand and you didn't have your psoriasis, what would you do differently? And it will usually be things like, I'd take my son swimming, for example. And what that does is it really centralizes what that patient wants. You're not looking at a DLQI, a Dermatology Life Quality Index, which is a tool that everybody uses to assess the impact. You're actually looking at that individual and you're saying, right, how is life going to be different from you? And what that then gets you to do as a healthcare professional is, on a psychological sense, you're instead seeing a human rather than a patient with numbers. And you can then revisit those goals with those patients with time. You're supporting a person to live their best life, not just treating a disease.
Yeah. Thank you both. That's a very beautiful place to end this episode of Beyond the Flare. And I want to say a huge thank you to our guests for sharing their thoughtful perspective and experiences, and to you, our listeners, for being part of this global community. Be sure to subscribe so you catch our future conversations. And until then, take good care of yourself and each other.